Let's get started. This afternoon, let me thank you all for being present. Today, I'm here with Mayor Pro Tem Dave Martin, Councilmember Pollard, and Councilmember Alcorn. Also, Chief Pena, Chief Acevedo, Dr. Purse, Stephen Williams. Director Williams is also present. Let me just say that the Houston Health Department today is reporting 963 new cases of COVID-19, bringing Houston's total to 24,336. And as you can see, the numbers kind of fluctuate. On Saturday, we, I think, reported 234. Yesterday, Sunday, was 489. Today, the number is 963. So we still have a lot of work to do, Houston, to slow the progression and bring this virus back under control. And so the good news for today is that we're not reporting any new deaths. We didn't report any new deaths yesterday. We're not reporting any new today. But I would tell you the death count is kind of like a lagging indicator. The more the community spread, the more people go to the hospital, the more they go to ICUs, and then that's when the death count starts to creep up. Hopefully that will not be the case, and so we just need to work together collectively to blunt the progression of this virus. Now let me just say, we are, again, we're sending a letter, plan on sending a letter to the Executive Director of the Republican Party of Texas, strongly encourage the GOP to cancel its in-person convention scheduled to take place on July 16 at the George R. Brown Center. I believe canceling the in-person convention is the responsible action to take while we are in a critical moment in our battle against the COVID-19 pandemic. The virus continues to spread in our community, and we must protect the employees, the people who are in our city, visiting our city, as best as possible. And so let me just say this, in this city, all other conferences and conventions have canceled or been rescheduled to next year, with the exception of one. All of our conferences, all of our conventions that were scheduled to be in the city of Houston at the George R. Brown have canceled or been rescheduled to next year, with the exception of one, and that's the State Republican Convention. And so, and we have to be mindful, and I would ask them to be mindful of the employees, the people who are working at the George R. Brown Convention Center, people who are working even at the hotels, people who will be serving them. Be mindful of their health, the people who are visiting, the people who, for example, who are living in the city of Houston in the midst of this pandemic, and be mindful of what we are facing right now. I've not yet talked to a medical professional who has said that this is a good idea to hold this convention at this time. I visited extensively with Dr. Purse, talked to Dr. Peter Hotez, just talked with him again today. All are saying that hosting a convention, an indoor convention, at this time in the city of Houston is a bad idea. And I'm going to call on the sponsors of this particular convention to join in with us in asking the State Republican Executive Committee to cancel their plans to have an in-person convention in the city of Houston at this time. And I would strongly recommend that it be a virtual event. As I continue to evaluate this convention, having a convention in person in the city of Houston, at a minimum, there are certain things that will be asked of the people if they elect to proceed, and if not, additional action is taken by the city. There are certain things that will have to take place, and this will be forwarded to them as well. They must enforce the governor's executive order on the use of face coverings, masks, or face shields if face coverings are not available. That will be a must not only to get into the convention, but while they are participating in the convention, where there is more than one person present, face coverings will be a must. In addition, they must modify the layouts of the convention to promote social distance of at least 6 feet between people, limit attendance, seating capacity, host smaller events in larger rooms, use multiple entrances and exits, and discourage crowded waiting areas. Block off rows or sections of seating in order to space people 6 feet apart in all directions, left, right, back, and front. Eliminate any lines and encourage distancing by providing signs or visual cues. Install physical barriers and guides to support social distancing. Serve individually plated meals, grab-and-go options, and hold activities in separate areas. Limit the use of elevators and ensure that the number of people using the elevators. Encourage attendees to use transportation options that minimize close contact with others. Limit non-essential visitors and volunteers and activities involving external groups or organizations, especially with those who are not from the local area. Conduct daily health checks, such as temperature screens or symptoms checking on all staff and attendees. Use wristbands to validate daily health checks. Keep a track of attendees by sections, i.e. Signing sheets, scanning, exception, etc. Keep a master list of all attendees that includes the following information: name, date of birth, address, phone number, email address, hotel and hotel rooms. Put in place communication systems for individuals who may self-report COVID-19 systems. All of that will be required. Attendees who develop symptoms or test positive for COVID-19 during the convention or on the 2 weeks following the convention must notify convention organizers, who will then coordinate with local public health in Houston and in the attendees' local jurisdictions. All of these measures and more have been put together by Dr. Purse and his health team. All of this will be made available to the executive committee. We expect all of these rules to be strictly adhered to if this convention should go forward. In addition, there will be health inspectors and monitors that will be at the convention the entire time. To the extent any of these measures are not adhered to and adhered to in the strictest of terms, then the health inspectors will have the authority to immediately close the convention at that point. These are serious times, and this pandemic is very serious, and we take it very seriously. And because of the situation that we find ourselves, it is important, for example, that we take every conceivable measure to protect the health and safety of these employees and their family members, as well as the people in our city, all of the people in our city, the delegates themselves, and as Dr. Hotez mentioned, many of the delegates who will be attending fall within that vulnerable population. And so we want to be sensitive to them as well. I do not think it is wise or prudent to hold an in-person convention of 6,000 or more at this point in time. And again, I will call upon the executive committee as well as the sponsors to change their minds, to go to a virtual convention, and especially the sponsors of this convention. I would ask for them to reconsider their position, and as best as possible, we'll provide a list of sponsors and encourage them to join with us and the Texas Medical Association in encouraging the State Republican Executive Committee to head to a virtual convention. But if not, all of these conditions and others will be required These are not optionals. These are things that must take place, and they must be strictly adhered to. Having said that, let me yield and bring up Dr. Peirce. There you are.
Thank you, Mayor, and I echo the Mayor's sentiments about the convention. I think that the wise, prudent thing to do would be for the Republican Party of Texas to reconsider their position, keeping in mind their members and the people who will be supporting that event. The virus is serious. Okay, we've got here in Harris County alone. Again, today we have over 500 people in intensive care units within Harris County, and there's another over 1,300, I believe, today, people admitted to local hospitals. They're sick enough to be admitted to the hospitals. The hospitals are working together to transfer patients amongst them. Now, these are hospital systems that don't routinely work together. They're businesses, and there's some, they're like siblings. There's some sibling rivalry, there's some sibling dependency, but they are, from a business standpoint, they're often in competition. Well, they are not in competition now. They are extremely dependent on each other as they try to manage the patient load. And so another large event like this, which is known as a super spreader event, is probably not the most responsible thing to do. And so I call on the RPT to consider a virtual convention, which can be highly effective. Others have done it. I think all of us now in business are having virtual meetings every day. And so I think that's a viable option for them, and I hope that they will consider that as the best route forward. In addition, there have been a couple of things that have been in the popular media that sort of need to be mentioned in light of the conversation we're having. That is that there is evidence now that the virus may have yet mutated yet again. So we spoke several weeks back about, probably a month or so ago, about how the virus had mutated in Northern Europe and it became more easily transmitted. So there are some reports out now. This is very fresh information. It's just coming out. And some of the popular news feeds have picked up on it ahead of time, so I haven't actually seen the scientific paperwork on it yet. But it appears that the virus has mutated yet again, allowing it to spread even more easily. Now, fortunately, it does not appear to be any more lethal, so that's good news, but it's spread more easily here, and this is a new twist that appears to have occurred here in the United States, this new mutation. Simultaneously, there is a document of over 200 signatures from scientists around the world going to the World Health Organization asking them to reclassify the virus from being droplet transmission to airborne transmission. And so what that means is that when it's droplet transmission, that the virus would need to be in a droplet. Now, those droplets can be microscopically small so that you don't see them with the naked eye. But even so, they tend to still fall out of the air. And so this is where the 6 feet for 15 minutes rule is based on the behavior of droplets. If the virus is actually airborne, and there are other airborne viruses, and I always use the example of measles virus, that means it doesn't need to be attached to a droplet. And it's that droplet that pulls it out of the air. So if the virus is actually able to survive on itself in the air, it is so very light that it will float around in the air for quite some time. That would be a game changer for us. And if that's the case, if this virus has maybe these two things that we're seeing are related, maybe the mutation not only makes the virus more easily transmitted, but it also is what's allowing it to be airborne. If that's the case, then that means that a super spreader event like a convention would be probably triply dangerous at this time. So the virus is changing. Our environment, as we learn about this virus and as it changes, is constantly changing. And I want to remind folks that today in Harris County, over 500 people are admitted to intensive care units. They are extremely sick. When you hear the testimonials from these folks, they will tell you that they were afraid that they were going to die. Now, they survived. That's how they were getting the testimonial from them. And I remember in medical school being taught, I had a very elderly professor, I'll never forget, he said the way you diagnose the flu is the patient wakes up feeling fine. By noon, they're so sick they're afraid they're going to die. By 5 o'clock, they're so sick they're afraid that they won't die. And so we're hearing these testimonials from people who are so sick, they were afraid they were going to die, and I actually heard some said they were so sick that they were afraid that they weren't going to die. They were so sick that they felt they would rather have died than have to suffer anymore. So the fact that it's younger people who are getting it and people aren't dying as much completely misses the fact that this virus, for the people who are getting sick and winding up in the hospital, are having terrible, terrible times. And now that their families are going through terrible, terrible times as they worry about their loved one who's in the intensive care unit suffering. And they are suffering with a capital S. So please, let us not underestimate just because people aren't dying at the rate that they may have been, that this virus is any less dangerous or painful to those who get it.
Chief Pena.
I don't know how to follow that up. That's not good news, Dr. Pearce. For the fire department, I want to give you the numbers that we see in quarantine as of today. We are still around 280 firefighters that are in quarantine, and those are firefighters that have been exposed in and outside of work. The majority of those have come from community spread. We continue the same posture on the fire department to provide the tools, the equipment, the protocols, the support for our fighters to remain safe. But we are seeing an enormous amount of firefighters that are being exposed through family members, relatives, just the activity in the community. I want to make one thing clear, is the staffing issue is something that we have been talking about here for weeks. We've been mentioning the fact that as more firefighters are in quarantine, it's stressing our ability to staff our units. But I want to make one thing clear, because this is in the media and it's been put out, there are no fire stations that are closed. If there are issues with staffing, we're going to prioritize the staffing on our ambulances and fire engines, but every station will have a fire engine at least inside those stations. Okay, I want to clarify that. I want to remove any doubt or any misconception about what this means. We are working overtime to ensure that we're bringing people in. Our firefighters are working extra shifts. They're volunteering for voluntary overtime. We're keeping them in there at the stations, those that until we find proper relief. And I appreciate the effort that they're putting out in order to protect this community. But I just want to make sure that we're clear on what the impact is to this community. We are not closing any fire stations. Our response times for June are about 7.5 minutes, 7 minutes, 18 seconds. And that has gone up a little bit since January, about 20 seconds since January. So we're maintaining the operations. That doesn't mean that we're not being stretched in. We have about 1,100 calls for service each and every day. And this is an opportunity for me to remind our community to make a judicious use of the 911 system. 911 system is there for you to call when it's a true medical or safety emergency. Okay? We want to reserve those precious resources for the critically ill and those emergencies that are life-threatening. We don't transport people to the hospital to get tested or evaluated for COVID. Okay? I mean, that's not the proper way or proper use of our resources. And the hospitals are seeing a saturation as well. So you're not going to be seen any quicker if you go through the ambulance. But if you're having an emergency, a true medical emergency, chest pain, stroke, labor, any of those issues, call 911. That's what we're there for. And we're going to have plenty of resources. All our fire stations are staffed. Again, we're prioritizing our ambulances and our fire engines here in this critical staffing situation. That's my report. Thank you, Mayor.
Chief Acevedo.
Thank you, Mayor. Good afternoon, everybody. Currently, we have 206 members of the Houston Police Department that are quarantined, and we've had up to now, Mayor, 263 positive tests in our department. We've had 116 that have returned to duty, 120 when you add our 4 civilian classified, civilian and support staff. And I'd like to just tell the community we're continuing to be fully staffed and fully capable to respond to any eventuality. And so it's having a minimal impact on our operation. But the good news is that most of our people have returned to work. We did just receive word a little while ago that one of our sworn members is now on a respirator, so I'm not going to release the name until I talk to the family. But you can just send prayers for someone that's in pretty tough shape right now, so we're worried about this employee. And with the permission of the family, we'll try to get out the name later so we can be deliberate on who we are praying for. That's our report, Mayor.
Thank you, Chief. As COVID-19 cases surge across Houston, Hispanics are affected in disproportionately higher numbers. The Houston Health Department is today launching a 21-day emergency outreach program, Better Together, Todos Juntos, Mejor, to curb the ravages of the disease in this vulnerable population. The program educates Hispanics about the combination of behaviors proven effective in preventing the spread of the virus and helpful resources to locate and use free testing sites throughout the city. It also shares valuable information for families requiring assistance with food, housing, and mental health issues. The initiative will reach the Hispanic community through culturally relevant messaging and vehicles, including a virtual media tour that took place this morning, Trusted Voices toolkit for community organizations, influencer message amplification, paid social media advertisements, and more. So again, let me just say that we're in the midst of this pandemic. Again, I'm asking all Houstonians over the next several weeks to come together and let's do everything on our part to slow the progression of this virus. Please wear your mask. Please do that. Please engage in social distancing, exercise proper hygiene. And again, I want to call on the State Republican Executive Committee to reverse this decision and not to have an in-person convention, but to have a virtual convention, which would be in the best interest of everyone. And I certainly want to thank all of those other organizations, groups who have elected to cancel and reschedule their conferences and conventions until next year. This is the only one that's remaining for the greater good of everyone. I'm hoping that they will reschedule or cancel and turn to a virtual conference. Having said that, this is a good time to take any questions if anyone may have them.
Okay, I have several questions from our station. Dr. Peirce, what challenge is there in staffing the surge capacity, especially given how taxed doctors and nurses already are from months of dealing with this?
That's a good question. My understanding is that about a week or so ago, the Vice President had a conference call with governors from across the United States. He said, if you need anything, let me know, we got it, we'll get it to you. So what I've learned over the weekend was that the state of Texas actually reached out, and today an assessment team arrived in Houston to start looking at what hospitals may need to accommodate the surge. And the early conversation is that they seem to have quite a bit at, we don't know if they have everything at their disposal, but they've got equipment, they have personnel, and also, computer programs and a variety of other things that we're learning that have been put together by the federal government specific for this. So at this point, also the state has kicked in over the weekend. We got about 120 nurses into the area. Some of those went to hospitals in Houston. Money went to hospitals across the 25-county region to help support the two things. One is the expanding operations the hospitals are engaged in, creating more beds, and also providing some relief to some of their exhausted nurses now. So, as you can imagine, this is a dynamic and constantly evolving situation, but we are starting to get help from outside to address exactly what you point out. So, again, the healthcare system is working hard. They are increasing capacity, both physically and with human resources, but it's taking an awful lot of effort. So everything that we as Houstonians can do to reduce the burden on the hospitals, which also reduces the illness amongst us ourselves, is a really smart thing for us to do.
One more for you. How much better are we prepared to handle surges and spikes given what we've learned from places like New York?
So sorry, it's like I get so many words coming out of my mouth at once I don't. But we've gotten a lot of help from our colleagues in New York and Washington, both technical expertise, and my understanding is that some of the nurses that are coming to Texas are actually coming from New York and the New England states, not just New York City, but from the New England states. Because remember, when New York had trouble, people from all across the New England states went to New York to help out, and now they've returned home, they've gotten a rest, and they've made themselves available to now respond elsewhere in the United States. And so, this is just Americans helping Americans, and that's what we're seeing happen. So,
thank you. Mayor Turner, any update on your, was it the Wall of Shame? It's our understanding that one of the bars, clubs on there is now suspended.
There's no updates, and we've renamed it to the COVID-19 Accountability Wall, So it's the COVID-19 Accountability Wall, but no updates at this time.
Okay. Chief Pena, how long can the Houston Fire Department keep this up, being 100 or more firefighters short every day? And how many units were out of service for at least a short time since Friday?
Since Friday? So let me answer your first question. We're hoping that as a community, if we do our part to kind of tamper down the spread of this virus, that's going to translate into more firefighters being available, less in quarantine, less exposed. Look, we're working, as I said, overtime. We're bringing in personnel. Some people are working 1 or 2 extra shifts on their days off, and we appreciate the work that they're doing, their commitment to this community. In regards to the number of units, on Friday, we idled 1 unit, 1 ladder truck, ladder 28. Out of 38, 1 was out. On Saturday, we had 2 units. On the 4th of July, we had 2 units. But again, they're being strategic, and the shift commanders are being strategic in selecting those units. It sounds minimal, but that's 8 people that we could not get in just because of the shortage and the number of people in quarantine. Again, this is an issue that even the best staffed departments are going to have a hard time staffing their units. When you have 300 firefighters, to us, that represents almost 1/3 of what I would need each shift to fully staff every apparatus. So that means that other firefighters are pulling the weight, coming in on overtime. And we're graduating, by the end of next month, we'll graduate 80 firefighters that are currently in the training academy class. We're bringing in firefighters that are in quarantine. They're going through the evaluation process, and we're expecting them to be released back to work. But at some point, we're going to have to make some decisions. Depending on CDC's guidelines, we may be looking at bringing in firefighters that have been exposed but are not symptomatic. Again, I have to get with our medical director, see what the CDC recommends. But we're dealing with a pandemic and a huge health crisis, and we're going to do whatever it takes to ensure that we are providing coverage for this community.
Okay, thank you. Chief Acevedo, I have one for you too. Will you join calls for an outside audit of HPD to determine how the errors and mismanagement were allowed to happen for so long? Sure. Sure, I do have one more for the mayor.
And I'll be prepared to answer that question.
Awesome, thank you.
The answer is no. Okay, next question.
Can the city or county just cancel the convention or yank the venue?
We are assessing all of our options. Our number one concern is the health and safety of our employees that will be working at the hotels, working at the George R. Brown Convention Center, Houstonians themselves, the guests as well. Because bear in mind, most of the people, the delegates, will not be coming from the city of Houston. They will be coming from outside of the city and then returning back to their own respective jurisdictions. So we are very much concerned about that. So the health and safety of everyone is our primary concern. And as you can see, we are laying out a number of measures at very minimum will have to take place in order to kind of keep everyone safe. But we are continuing to assess all of our options and evaluate all of our options to see whether or not this will even get us to where we need to be.
Thank you.
Let me also indicate, with regards to one of our employees, municipal employees, has died as a result of COVID-19. And this particular employee tested positive on June the 20th and then was hospitalized on June 24th. An employee in her 50s, but who has succumbed to COVID-19. This just highlights just how serious this virus is. Okay?
I have a quick question for both chiefs in Spanish.
Sure.
¿Cuántos bomberos y policías están en cuarentena? ¿Cuántos han dado positivo? ¿Y qué impacto ha tenido esto sobre los departamentos? ¿Qué anticipa que sea la situación las próximas semanas? ¿Y qué le dice al público ante la situación?
Bueno, de lo que va del Departamento de Bomberos, tenemos 67 bomberos que han sido positivos por el coronavirus. De esos, aparte de esos, son 148 los que se han sido expuestos al virus pero ahorita 67 están positivos. En cuarentena tenemos 280 bomberos ahorita que están en cuarentena, acerca de haber sido expuestos al virus. Y eso está teniendo un impacto en nuestra habilidad de tener bomberos accesibles para tener todas nuestras unidades en servicio. El viernes pasado tuvimos una unidad, una escalera, ¿sí? De 38, una no pudimos tener bastantes bomberos para tenerla en servicio. El sábado, el 4 de julio, tuvimos, como le digo, los 300 bomberos no tuvimos accesibles para tener 2 unidades en servicio. Pero estamos dando prioridad para las ambulancias primero, las trocas y las trocas de bomberos. Así es que ni una estación de bomberos va a estar sin tener cobertura. Todas van a estar cubiertas. Si hay necesidad de tener una unidad sin servicio, primero van a ser las escaleras, ¿sí? Pero esa es nuestra prioridad. No es situación de que no haya dinero. El alcalde Turner nos ha dado los recursos para ocupar a bomberos en tiempo extra. Ese no es el problema. El problema es que tenemos, como le digo, 300 bomberos que no tenemos accesibles porque están en cuarentena. Así es que no hay bastantes personas para traer en veces. Dependiendo en la cuarentena, dependiendo en cuántos llamen que están malos o por otras situaciones. Pero nuestra prioridad es tener todas las ambulancias y todas las trocas en servicio y tener cobertura en todas las estaciones.
Buenas tardes. El Departamento de Policía de Houston tenemos un total de 188 oficiales que están en cuarentena y 18 civiles. Hasta ahora hemos tenido 147 oficiales que salieron de sus pruebas positivas y 16 civiles. Y de esos, tenemos 120 que han regresado al trabajo. No tenemos ningún problema manteniendo la seguridad pública. Todas las llamadas de emergencia las estamos dando el servicio igual que siempre y seguimos adelante con los oficiales que tenemos.
Some questions for Dr. Peirce. How big of a spike do you expect to see with this 4th of July weekend?
Well, I'd like to hope that there's going to be no spike related to the 4th of July weekend. I think that the mayor and the judge did a good job of getting out the message about how to behave on the 4th of July, and I know that in my circle that we all adhered to the rules. So I'm hoping that we won't see any. So it's kind of hard to answer your question. Beaches were closed, and here's the other thing, though. Quite honestly, if you look at the graph, there has not been a spike. It has been a steady increase all along. So there wasn't a Mother's Day spike. There wasn't a Memorial Day spike. Things just got more and more steep. And so what we need to see happen now, and with the the mask order and a couple of other things have been put in place to change the curve, what we need to see now, you need to see the curve not spiking but turning down. So I can't predict the future, but I can tell you what I'm hoping for.
So, Doctor, once again, when we talk about the test between the nasal swab and the rapid test and the saliva, you've mentioned in the past that there seems to be a lot of negative results from some of those quick rapid tests. What do you recommend to the people, and people who have had COVID, do you recommend them testing twice before going back?
All right, good questions. There's several questions there. One is the nasal swab tests that go off to a lab that take a day or two or sometimes 5 to get the results back are highly accurate. Those are probably the most accurate tests. Nasal swabs take a few days to come back, most accurate test. The next most accurate test is the one that's brand new and is just hitting the market. That's the one with the saliva test. It's an antigen test. It's not testing for the RNA of the virus, it's testing for the protein on the outside of the virus, but still testing for the presence of the virus. These are brand new. Those are also pretty accurate, but they still have to go to a sophisticated lab. These are not what we call point of care, where you, like the finger stick test, where you get the answer in 15 minutes. Those ones, there's 2 kinds of those, and without getting too much detail, I don't consider those to be terribly reliable. There is one test that is the Abbott ID Now test, where you can get an answer in back as little as 15 or maybe 30 minutes. If you get a positive result, that's pretty reliable. Unfortunately, they miss a lot, so negatives really don't help you out at all. So the point is, there are many, many tests out there. It gets very confusing. So what I tell my friends and family, the nasal test, the one that goes up in your nose and takes several days to get back, that is the most reliable of tests.
What about the people who have tested positive going back to work? Do you
Well-
recommend taking two?
Well, yeah, so this is our position hasn't changed on this. The clinical criteria for folks, if they became ill, they test positive, they became ill, 3 days of no fever with no fever-reducing Tylenol, Motrin, any of those medications, none of those medications, no fever for 3 days, and at least 10 days from your first onset of any symptoms at all, and you're feeling totally fine on that 10th day, then you should be cured. You should be able to go back, and you're not shedding virus, not at any risk for anyone. The option is to go 2 days, get tested twice, at least 24 hours in between. That just consumes a lot of tests that right now we really need for other purposes. There's no great advantage to that. So I recommend the clinical determination that you're cleared.
Mayor, Judge Hidalgo was heard over the weekend saying that Texans need to take a step further than just a statewide mask order. And closing businesses, again, does not align with the strategy of the governor and state leaders. Where do you stand at this and at the point of another lockdown?
Last week, I made several recommendations, and one that was to reduce our occupancy, be below whatever your stated occupancy is right now. I still stand by that recommendation. These are things that I've asked people to do voluntarily, certainly to reduce the number of people within their establishments, to work remotely where possible, especially if you cannot work in social distance, then work remotely from home. I've encouraged and asked our faith-based community to have their services, worship services virtually. And I've asked people to do all of these three things over the next 3 weeks. So wear the mask. Of course, bars and clubs are closed. We've scaled back, the state has still scaled back the occupancy for restaurants from 75 to 50%, and asking even businesses to go even below that. And this is voluntary. This is not mandating, but to go below, to reduce the number of people that are coming in close proximity with one another. And then for faith-based institutions to worship virtually. I think if we do all of those things in concert over the next 3 weeks, we ought to be able to see the slowing down of this virus. But it requires all of us to be doing these things at the same time.
Has the city reached out to Abbott about declaring another stay-at-home order?
I have written a letter to the governors, as well as the other mayors have written letters to the governor, asking for certain measures to take place. Look, number one, let me thank the governor for the mask order statewide. That was a significant step in the right direction. He's given local governments the authorization to limit outside gatherings to no more than 10. So that has been helpful, and I want to thank him for that. And then it is just important for all of us to do our part. We don't need large gatherings of people, especially indoors. Okay, especially indoors. So it's going to take all of us to do our part in order to slow the progression of this virus. Again, the goal in March, April, and May were to put us in a position where our healthcare delivery system was not being overwhelmed. That remains the goal today. And so today I reported 963 cases. We need to do everything we can to get that number down below 300. Because if we can get it below 300, then I think our contact traces will be much more effective.
Dr. Pearce touched on the ICU beds a little bit.
Top of the hour here, you're watching the mayor's press conference from City Hall. We'll get you back to that. The 411 will start as soon as this wraps up.
If so, what needs to happen to avoid the crisis?
I think the Texas medical system, are they still in stage 1? They're still in phase 1. They're not in phase 3 yet. So they still have room to expand. So there's still room to build out, to have more bed capacity. What everyone is working to ensure is that they will always have enough bed capacity, and which means that we have to slow down the progression of this virus on this end. So the fewer people that are getting positive test results, the fewer people that end up getting sick and then find themselves into our hospitals. So for right now, there's still bed capacity within most of our hospitals. I think the only two that may be at that limit might be Harris Health, Ben Taub, and LBJ. But with respect to everyone else, I think there's still bed capacity. We just want to keep it that way, okay? All right, having said all of that, I think that's more than enough for today, and thank you all for coming and participating in the press conference. Thank you.
Mayor Turner there wrapping up his press conference for the day, giving us some new numbers and some new warnings while he's asking the state Republican Party to cancel their convention scheduled for 10 days from now over at the GRB. The 411 starts right now.
The 411 on KHOU 11 News.
Today in Harris County, over 500 people are admitted to intensive care units. They are extremely sick.
Dr. Pers, with those numbers there, the mayor saying that Houston hospitals could be overwhelmed by COVID-19 cases in the next couple of weeks if we don't do enough now to slow the spread. The only living suspect